The primary purpose of a consultation is to evaluate if you are a candidate for a hair transplant procedure. Now, while many doctors' offices claiming to offer hair transplants more or less claim that everybody is a candidate for a hair transplant procedure, we here believe differently. We believe that a patient should first be evaluated to see if they are a candidate for the procedure. Because what's the point of doing a procedure on somebody if, one, it's not needed, or if two, if it's performed, it's not going to make much of a difference. And there's many reasons for this that you'll see in other videos. So when you come, what we'll do is we will evaluate to see if you are indeed a surgical candidate for the procedure. And while you're here, we'll even take you into the back and show you a patient who's actually having a procedure at the time. Now, of course, that patient's privacy is fully respected. If they don't want somebody to view them during a procedure, we, of course, won't do that. But you'll find that most people will allow you to visit them while they're actually having the hair transplant experience. See, we don't knock patients out for the procedure. They're awake during the procedure. And most of the time, they're either communicating on their phone, watching a video, or they just have their earbuds in and they're sort of tuning out. And many people just fall asleep, like on a long airplane ride. But during your consultation is when you'll have an opportunity to ask some questions about the procedure, to hear how the procedure might be tailored to you, and you'll get other details like how much it'll cost. These are the sorts of things that you need to have that personalized experience with a hair transplant doctor. So when you sign up for consultation, make sure it's with a physician who has been in business for at least 10 years, has at least 100 before and after photos, and has at least 100 before and after videos. There is no reason nowadays for a qualified hair transplant physician to not have 100 before and after examples in video format online. When you have your consultation, you might want to pick a few videos and say, you know, what are my odds of being able to look like this person or having hair like that person? That's the personalized part of the consultation. You want to go in and meet with the doctor. And that's what will happen when you come and meet with us. But again, the primary and really only reason for a consultation, the most important, is for you to be evaluated for your surgical candidacy for that particular clinic.